Some really horrific stories actually came out today. Just things like what's going on with the hospital system, close to breaking point, massive staff shortages, nurses working crazy hours just to keep the system going, aged care workers, massive shortages in an area where you need people to be working, and of course. We've got situations where people are no longer being told that they've been working with positive workers in the workplace, which means they go home to their families, possibly exposing them. This is just not good enough. And unions across the board have decided we need to do something about this, and we need to do something about it now in order to make sure that workers across the country are safe.
Yeah, in particular, you're calling for free rapid antigen tests and for workplace COVID safety plans. What do you envisage those safety plans would look like?
Well, look, we're in a new era now. I mean, we've got this situation where essential workers, these frontline workers who have carried us through the pandemic for the last couple of years, have suddenly been told, oh, we're changing the rules for you. We're changing the definition of close contacts, and somehow, hopefully, that'll solve everything. It's like something out of utopia, frankly. We need to really think about what's going on here. We need to make sure that these workers have access to free rapid antigen tests. They're the ones on the front line. And with COVID safe plans, we're in a new era now. We're in this era where Omicron is out of control, and we need to make sure that all workplaces and the massive top of the supply chain, who have got many employers and workers under them, make sure that their workplaces are providing the right sort of PPE, have got rapid antigen testing, and are doing all of the things to minimise the risk of the spread at work. Otherwise, we're just going to see this absolutely explode through workplaces, and we're going to see supply chains just come to a grinding halt.
Yeah, last week, transport was added to the list of sectors where eased isolation rules for close contacts apply. Do you want that reversed?
Well, we do. We don't see why something like that is necessary. It's only necessary because the government has lost complete control of this. And the tragedy, Karina, is that for months and months, in fact, 6 months ago, the TWU and RTO, the employer organisation in the transport industry, warned the Prime Minister in a letter to the Prime Minister saying, we need free rapid antigen tests as a priority in transport to avoid this very scenario. And we got an arrogant response months later from the Prime Minister, essentially telling us there was nothing to worry about anymore. And of course, what's happened, well, we're not Robinson Crusoe, we've just seen what's happened around the world, is that we're now in a situation where we've got massive labour shortages. And the answer isn't simply to change a definition. You might get a sugar hit of a week or so where all these people flood the workplace. But of course, all that's going to happen, Karina, is everyone that hasn't already been infected will be infected. So this is a situation that was eminently preventable. The government failed to do it. And now we're in this situation where they're just doing crazy things like changing workplace health and safety laws to the workers that have kept this country moving and that have been themselves on the front line. How can we have a situation in this country, Karina, where we say to the group of workers that are on the front line that are most exposed, that the rules are different for you, that you've got to come to work and expose yourself and your families further, but the majority of the country can keep other close contact rules that we've had for the last couple of years? That just doesn't make any sense. And the worst part about all of this is the government could have prevented this months ago.
Yeah, but you say that the change in definition is like something out of utopia. But given that we have such high vaccination rates in the community now, and these are critical sectors to keeping the economy going, isn't that just entering the next phase of the pandemic, and that the advice changes and alters as we get more information?
Well, we're still seeing situations where transport workers are getting ill. Their families are ill, and in many cases, just because we're at high levels of vaccination, doesn't mean that these people are getting any less ill. We're still seeing hospitalisations. We're still seeing people who are really sick with the disease coming into to the hospital system. There, of course, there's a way between 0 and 100. There's something between doing absolutely nothing and having a lockdown. You can still have sensible rules with masks and PPE and social distancing, and just doing some common sense things in the workplace. And of course, rapid antigen testing would have been the most common sense thing to do of all. In the UK, for over 12 months, that's what they've been doing, and that's enabled the workforce in that country to keep going to work every day while they've gone through different waves of this pandemic. We seem to have just had a government that's completely ignored that advice, and now we're in this situation where it appears that the only solution for the government is just to change rules. We could have prevented this, Karina, is the problem.
Yeah, that supply of rapid tests is affecting basically the whole country. I wanted to ask whether you anticipate that there will be industrial action over this, because I assume that the government hasn't sat down with unions and heard their concerns recently?
No, they haven't. True to form, this government tends to ignore everything we have to say about this, even
but
when...
it wasn't that case earlier in the pandemic. There were good relations between the government and unions.
Well, this is the thing, though, Karina, is that the union movement has always been willing to work through this. I mean, at the end of the day, we out of most people, out of anyone really, want to see workers safe and at work. That they're our members. They're the people that we represent.